patients that was not there. So to the extent to which the committee may have said in their report, unless the media misreported, to the extent to which they could have said that there was any medical detail that was missing in terms of the files, that's false. We also supplied 476 affidavits times 2. And why this times 2 is that there were 2 affidavits, the donor and recipient. And the 476 patients are both Kenyan and foreign. We supplied every single patient's affidavit. Now, to the extent to which we've seen in the media that they say there were some affidavits missing or the affidavits had shortcomings, that's completely false, and we dare the committee bring out the report that we supplied to them, and where we have the return copies and we can demonstrate that indeed they had them, and if they did not see them, it is as a result of their illegality. Now, there is one aspect of it that also we need to point out. In all those files, in all those affidavits, they had asked us also for the contact details, not only of the patients, but also of the doctors, and even of the advocates who are involved in the making of those affidavits. Now, when they criticize the issues in terms of patient details, in terms of patient contacts, all those were supplied. We do not seem, gleaning from what the media has said, them saying that they contacted any of those patients or any of those doctors and found any of the information we supplied to them to be inaccurate. And so where they criticize, either in terms of signing, in terms of dating, in terms of propriety of the documents, we are completely puzzled. We are amazed. Now, the other thing I wanted to mention also is that the patients themselves have a WhatsApp group. And I need to say that the WhatsApp, I just need to say that in respect to what we noted from the media, that they say we did not have a proper follow-up procedure. We need to explain that the 476 patients is constituted of both domestic, that is Kenyan patient and non-Kenyan patients. The WhatsApp group had about 277 membership. This is constituted of the patients in Kenya. And the WhatsApp group was meant for encouraging each other, for solidarity, for sharing experiences in the journey of their treatment. Now, from time to time, somebody would have an exceptional issue and they would chat with the doctors on the side, and Dr. Murthy will address that issue. And so we had a very robust follow-up process. They also had a follow-up process, as our friend Ben has explained. They had intervals of about 3 months to see the doctor if they needed to. And as time went on, either at intervals or when an issue arose. And so we really had a very good follow-up process. For international patients, the situation is that most of the time the patients would have been referred to Mediheal from out of Kenya by their nephrologists, by their doctors. And so after the treatment, more times than not, the patients would follow up with their respective doctors. Dr. Murthy will also explain this, that where those doctors, for those patients, had issues, they could call him or call the other doctors at Mediheal for any follow-up issues. And so we really had a very robust follow-up issue. And I just wanted to explain that that contention by the committee that there was no robust follow-up infrastructure or system at Mediheal is also false. Now, the committee also says that we had a number of things missing. One was the criteria of determining the recipient donor matching, the issue of standard operating procedures, the issues of policies on kidney transplant, infection prevention, quality management, and data protection. On this again, we are saying we dared them because we supplied each of those. We had SOPs, the standard operating procedures, applied to them. In that standard operating procedures, which we are ready to share with the media, it incorporated the policies on kidney transplant, infection prevention, quality management, and we had an overall hospital data management policy. And so when they say we didn't have criteria, we didn't have policy, we didn't have procedures, it is completely false, and we share with them those items. Just before I go far, just need to go back again to that issue of honor.